forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello everyone, I'm glad that I'm here once again to introduce another educational program of Imam Reza Hospital. Today I'm honored to host dear Dr. Nasim Hajipoor. Hello dear Dr. Hajipoor, I'm so happy that you are here. I'll ask you to first introduce yourself to our audience.
In the name of God, hi everyone. Thank you very much for your invitation, and thank you very much for your valuable program that I hope that it will be very useful for all of the trainees. I'm Dr. Nasim Hajipoor, emergency medicine specialist. I was graduated from Tabriz University of Medical Sciences in 2020 as an emergency medicine specialist, after that, I'm here as an assistant professor because of gaining the high ranked in board exam, and that's it.
That's great to hear that.
Thank you very much.
I know that you will have 2 courses during this program. I'm going to first ask you to talk about the first one. Please tell the title of your course and tell us about its importance and just briefly what it is about.
Yeah, of course. As you know, I have 2 courses that I would talk about them. One of them is about ABG and VBG analysis and interpretation in patients. Because as an emergency medicine specialist, we have so many patients that with so many chief complaints that they come to emergency room. We should have some lab tests such as ABG or VBG to confirm our diagnosis in some cases. For example, in patients that they come with abdominal pain and a high blood sugar, we should know that if it is a normal hyperglycemia, a simple hyperglycemia, or a diabetic ketoacidosis, or in patients with respiratory distress, we should have ABG or VBG to know that what is disturbances in the patient. And for the other patient, for example, in poisoned patient, we should have this lab test to know the problem and to have the best management for this patient. And for all the other patients, we should have this lab test.
Yes, as you said, actually analyzing of blood gas is very important in diagnosis of the diseases in emergency room. It's important, you're right, but upon completing of this course, when the participants complete this course, what you expect them to learn?
My expectation is that my trainees could train the analysis and interpretation of ABG and VBG, and the difference between ABG and VBG, how they could or they can convert the VBG to ABG, and what is metabolic acidosis, what is acidemia, what's alkalemia, and what's metabolic acidosis, when we have metabolic or metabolic acidosis or alkalosis, when we have respiratory alkalosis or acidosis, when we have the compensation, and when we could calculate the compensation. And I will train it to my trainees, all of them, to know about.
Okay, that's great.
Thank you.
And just I wanted to know who are eligible to participate in your course, and what will the duration of this course be?
The duration of this course could be in, for example, 4 hours to 6 hours. I can train it, and the eligible team is the emergency room nurses, the medical students, and emergency residents, internal residents, and all of the general practitioner that they have,
They have to learn, actually. This is very important.
Of course, it will be lasts for the trainees 2 weeks to know all about the ABG and VBG, and that's it.
Okay, yes, thank you very much. So you mean that 2 weeks is enough to know the differences between ABG and VBG, and to know all the analyses of the blood gas test. Okay, that's great. I want you to introduce the second program of yours. What is the title of the second program, and what's the importance of this course?
Yeah, the second course is Advanced Traumatic Life Support Series that we do in traumatic patients to evaluation of these patients. Because we have many traumatic patients that come to emergency room, we should have an algorithm to management of these patients and evaluation of these. For this cause, we should use the ABCDE for these patients to know that the life-threatening problems in these patients, and after that management these patients in a good way. For example, we started with the airway, and then breathing and circulation and disability, and the last one is exposure. And after the primary survey, we have the secondary survey and tertiary survey, and this.
Okay. And if we want to talk about the objectives of this course, can you tell us about the objectives and about the things that the participants will learn in this course?
Because the traumatic patients is a critical patient in some extent, in some times, and we don't have so time to management of these patients. For this cause, we should do this ABCDE for these patients to know the life-threatening things. For example, if the patient's airway is intact or not, if it is necessary for us to intubate the patient or not, and it's necessary for the patient to put the collar, for example, for these patients. And in B, we should know the life-threatening things in lungs, and that can be very, very critical for these patients. For example, the hemothorax or pneumothorax, the tension pneumothorax. We should diagnose them. For example, we have only 10 seconds to diagnose these patients and management the best way for them. And after that, in circulation, we should know the bleeding and if the patient is in shock or not. And we should fast the patient sonography, e-fast sonography for these patients. And after that, we should know the disability and the GCS of the traumatic patient and the size of pupils. And in E, we should expose the patient and examine everywhere that could be in hemorrhage.
Okay, thank you very much. And who are eligible for this course? I want to know about the target audience of this course.
The target audiences is the emergency medicine residents, the emergency medicine nurses, the general practitioners, that's the interns, externs.
Sure, everyone that works in the emergency department. And what's the duration of this course? How long it will be?
The duration lasts 4 weeks. To know all about the traumatic patient, the primary survey, what we should do, when we can intubate these patients, for example, how we should intubate these patients, what's the best size of collar for these patients, and what we should do in B or C, and what's the best way to sonography of these patients, that we want to know that these patients have free fluid in their abdominal cavity or pericardial or not. And it lasts approximately 6 weeks.
6 weeks?
Yeah.
So maybe 4 to 6 weeks is enough for this course.
6 weeks.
And I wanted to know if there are any colleagues of you that will assist you during these courses.
Yeah. In ABG and VBG, one of my best colleagues, Dr. Kashgsaray will help me. And in ATLS series and in primary survey and secondary survey, Dr. Alai will be help me as a membership.
Okay, that's great. Thank you very much. If there is any other thing you want to add about these courses introduction, you can say, or if not.
No, thank you for your great hosting, and thank you for your colleagues, and I hope you be successful.
Thank you very much.
Thank you very much.
Thank you everyone for watching us. Should you have further questions regarding this program or any other programs of Imam Reza Hospital, you can visit our website as seen in subtitle, or you can contact our expert team via email address. Thank you very much.